There's a simple formula to read any ECG, and that's your rate, your rhythm, your regularity, your axis, your intervals, and your context. So let's say I've been given this ECG. The first thing I want to do is to check my rate. And the quickest way to check a rate in any ECG that is fairly regular is to count how many big boxes are within 2-hour intervals. So I can see here that there are 2 big boxes and 1 small box. So roughly 2 boxes between each hour interval, 300/2, that gives me 150. So my rate is approximately, I know I can afford to be more exact, but this is going to be approximately 150 beats per minute. Then I need to check the regularity. Now, this is something I've already checked, my next hour. Regularity just means that roughly across, especially my rhythm strip, the number of boxes in between are the same. So there's still the same, about 2.2 small boxes, roughly across each hour interval. So that is settled. So this is regular. Now, the next thing I need to do is to check my rhythm. Sinus rhythm is P wave following every QRS wave. Is P negative in AVR? If this is true, then this is a sinus rhythm. And indeed here, there's a P wave following every QRS wave. I don't need to worry whether this is atrial fibrillation or another type of rhythm. So this is what we call a normal sinus rhythm. The next thing I need to do is to check the axis, and there are a lot of ways to check the axis. You can go the long way or the hard way, but assuming I've just been given a few seconds, I look at my lead 1 and I look at my AVF. It's positive in 1, it's positive in AVF. It's also even positive in 3. That makes this a normal axis. Now, that being sorted, I need to check the intervals. Now, the intervals I have are my PR interval, my QRS duration, my QTC, right? And yes, definitely. So my PR interval should be between 3 to 5 small boxes. And if I check across my rhythm strip here, if I count, what you will find is that my PR interval is 1, 2, 3, 4. So this is about, my PR interval is normal. My QRS duration should not be more than 3. We want our QRS to always be narrow rather than wide. So what you will find here is that my QRS is 1, 2, 3. 1, 2, 3. My QRS is narrow, which is lovely. Now, we have 150 beats per minute. We already know 150 beats per minute is tachycardia, by the way. But going back to our intervals, now a QTC interval is always printed for you. If you have 10 seconds or 30 seconds and you need to be fast or skim through, what I would check is whether my QT interval is taking more than half of my RR interval. So what I've said basically is check your Q and check your T. If that is more than half of your QT, of your RR interval, then it's slightly significant. In this case, it is not. So my QTC duration is likely normal. But of course, there are ways of calculating it and then using the Bazet formula to make sure that your QTC is indeed correct. The next thing I want to know is context, because no matter what I'm seeing on this EG, I need to know what my patient has. Do they have chest pain? You can have a non-STEMI, or you can have an angina in somebody with a perfectly normal ECG. So what are they coming with? Are they coming dizzy, collapsed, weakness? Because that will help me reevaluate this ECG. By and large, depending on what the context is, I already know that I have a sinus tachycardia. Now, even though this is a sinus tachycardia and can be caused by even simple things like anxiety, this can also mean more dangerous acute emergency phenomenon like PE. So you want to go back, look at your S1Q3, T3, even though in many cases you never find that in a PE ECG. But a context is what helps you make sense of the ECG. I hope this has helped you, because if you always use the RIC, you will be able to read any ECG. Have a great day.